Hello and welcome to this third and final lesson on creating and communicating an improvement strategy using driver diagrams. My name's Tom Margin, I'm a GP and I also work as a clinical lead at NHS Improving Quality. In lessons 1 and 2, my colleague David Griffiths and I introduced you to what driver diagrams are, and we use simple examples of losing weight to demonstrate how they can be used. In the second session, David dug deeper into why their driver diagrams are so helpful in unleashing creative thinking, avoiding blind spots, and also avoiding magic bullet thinking. In this session, we're going to look into how to undertake creating a driver diagram with your team in a step-by-step way. So here we have the driver diagram, a visual representation of the team members' current theories of actions and effects in the system. Essentially, what changes will likely cause the desired effects. It sets the stage for defining the how elements of a project, the specific changes or interventions that will lead to the desired outcome. You can also see the interdependencies of the different components of the system. So moving from left to right, on the left hand side we have our aim or our goal or objective, which is usually an improved system. Then moving to the right of that we have our primary drivers. These are the fundamental factors or components of a system that influence the achievement of the aim. And then over on the right hand side there are the change projects. Essentially these are the hypotheses to be tested to see if they can contribute towards achieving the aim. These are grouped together in themes around secondary drivers. So in summary, a driver diagram depicts the relationship between the different components in the system, with actions on the right hand side driving towards effects on the left hand side. I'm now going to take you through the stages of developing a driver diagram in 10 steps. Step 1. Get the right people in the room. At NHS Improving Quality, we've used driver diagrams extensively with smaller teams in single GP practices through to larger groups working across health and care settings. What we've found is that success is determined largely by having the right mix of people in the room. If you don't have a mix of stakeholders, it both constrains creative thinking and means the process loses its value as an engagement tool. So depending on the program you're working on, you should have certainly have patients or service users, clinicians, support staff, admin staff, essentially sort of people delivering the service, and then considering sort of spreading the net a little bit wider out to third sector, those who are commissioning care and also other care providers, and then thinking about non-health representation, for example, technology companies or other people who may have a stake in your system. Each person brings their unique insights into a challenge or into the environment you're working in, and this way you'll have richer discussions and more people will have an opportunity to have their voices heard, which adds value to the process as a means to engage with people. Step 2 is to develop your aim. We can't really overemphasize how important this is, and it's worth really investing some time and effort in getting this right. Michael Porter makes this point succinctly in the quote here: sound strategy starts with having the right goal. And we found that groups that really put some effort into this at the beginning often get more out of the process of developing their driver diagram and hence developing their strategy. An aim really should be specific, measurable and time-bound, and should answer the question: how much improvement, to what, for whom, and by when. And it really needs to have the so what factor in order to bring people with you on the project. It should connect with the visions and values of your organisation to stand the best chance of taking root, gaining momentum, and being delivered. When you're determining the threshold or measurements for an aim, and that's really important, an aim needs to have the how much by when, the measurement element to it. The team creating the strategy must decide how ambitious it should be. While there's no correct answer, an aim should be bold, so there needs to be sufficient stretch if it's for it to be achieved, and yet it's attainable. It should create a focus and a sense of urgency within an organisation, but always should be realistic, based on what the evidence suggests is possible. It's certainly not worth setting an aim at the outset that everyone on the team knows is impossible, because you're essentially setting yourself up to fail straight away. So it's striking the balance between ambition or stretch and realism. The next step is step 3, identifying primary drivers. So primary drivers are sometimes referred to as key drivers. They're the factors or components which contribute directly to achieving the aim. Just as with the aim, each driver should be able to be measured, and most drivers should align with specific process measures as well. So in this example, you can see we're using improving patient access to their GP. So that's our aim on the left-hand side. So 90% of patients getting GP contact within 24 hours by April 16. So we've worked on 2 key primary drivers here, first being reducing demand and the second being increasing capacity. Now there may be more than 2 drivers, but they may emerge during the process of developing our driver diagram, but it's worth trying to sort of highlight a couple to start with, just to help focus your thinking. So in this context, improving access, really, we've broken this down into reducing demand and increasing capacity. But it's worth remembering that there aren't any hard and fast rules, and sometimes when we've worked with groups, particularly if they're dealing with quite complex systems, then the primary drivers are a bit more challenging to identify. So we might skip this step, go straight into ideas generation, the next step, and then think about and see how the primary drivers might be emerging from that initial bit of thinking. But if the causes or levers in the system are well known, it's often easier just to first identify the primary drivers, and then you can move on from there. Step 4 is generating change ideas. So this is where the fun really starts. Generally, we get people working in groups of around 8, maybe 10 maximum on a problem. And first thing is to start with some quiet time. We encourage people to take 5, 10 or 15 minutes, however long it takes, working on their own to just think of all the possible ideas or projects that could be undertaken to help achieving your aim. The reason we say to work on your own is to avoid groupthink. Different professional groups work and think in particular ways, and if ideas are discussed from the outset, then there's a tendency for groups to close down lines of thinking based on their prior experience or thoughts about the situation, and this closes down fresh thinking, and it doesn't allow new ideas to surface and germinate. We also find that means there's less parity of ideas, so those with the loudest voices tend to speak up first and often can close down ideas from perhaps quieter members of staff or those who don't feel quite as empowered in this group situation. Then the group gets the opportunity to present the totality of their ideas afterwards, and we'll touch on that in a minute. So once again, each person needs to fill in as many of the post-it notes as possible with ideas for change projects to work towards the aim or the overall goal. And a couple of things we usually ask people is that you need to use a pen that you can read from a distance. So things like biros don't work very well. The pens like Sharpies or sort of thin marker pens are easy to read from a distance, which makes it easier to capture the ideas at the end of the day, and also to read them from a distance. And there needs to be one post-it note per, one idea per post-it note. Again, this helps make it clearer when you're describing the change projects to other people later on. And the change ideas need to be actions, so they need to contain a noun and a verb. So you can see here on the top here, pharmacists to undertake medication reviews. So that's got a noun and a verb, rather than just saying pharmacists or medication reviews on their own. So once again, someone else who's not directly associated with with this project should be able to read your post-it notes and understand what the action is from that you're trying to achieve. So once we've generated the change ideas individually, then the group comes back together and each individual gets the opportunity to present the totality of their ideas. We've called this the democratizing effect of the post-it note. This way everyone gets their say and each idea carries equal value. So people choose to do it in different ways. Sometimes one person can present the totality of their ideas and just one by one. Other times we just go around to the group, so an idea each at a time, so that keeps it fresh, keeps everybody involved. But there isn't really a right or wrong way to do it. You can try it out in different ways with your teams. So in this example, we've put all of our potential, as a selection of potential change ideas or change projects up on this slide around the aim of improving patient access to the GP. The next step on this is to group or cluster the change ideas into themes. So you can see in this example the green boxes represent activity to increase capacity, and the blue boxes represent ideas to help reduce demand. And by doing this, you start to identify the themes, and also you pick up change ideas or projects which don't necessarily fit under the themes that you've already identified, and this may be a sign that there's other avenues or other primary or secondary drivers that you have identified during your brainstorming or generation of change ideas. So the next step is to put things up on the driver diagram itself. So as you can see, aim on the left hand side, followed by primary drivers to its right, and then on the far right hand side we have the change projects, and these are grouped around the secondary drivers. So this is really the new step here. The secondary drivers have been identified by grouping our change projects around themes. So from our change projects, we've identified here 4 secondary drivers. So the top one being signposting patients to more appropriate services or staff. Number 2, developing alternatives to face-to-face appointments with a GP. Reducing the conversion to face-to-face appointments, and then planning or scheduling time for face-to-face appointments more effectively. And you can start to identify that there are particular drivers where, that have a lot of arrows going to them, and this can just help with the sort of prioritization process as you're going on. But you can see now we're really getting a good visual representation of where our activity may need to be, or the distribution of the change projects around the sort of secondary or primary drivers. But you can see a clear flow from a hypothesis on the right hand side to trying to achieve our aim on the left. So just picking one at random here, you've got increased registrations to pharmacy first there in the middle. Now the hypothesis is if we do that, that's signposting patients to more appropriate staff or services. So if we do that, we expect that to reduce demand, which we in turn think will help us to improve access to a GP. So change projects, hypotheses to be tested, coming towards achieving our aim on the left hand side. Step 7 is prioritising our activity. Essentially, you can't do everything. You can't probably undertake all of those change projects at any one time. So a useful piece of work is to then prioritise activity. So understanding how your project sits alongside existing assets, programs, and priorities. So these would be called your system. These are the system drivers. Look at the interdependencies on the driver diagram. So we highlighted before there are particular boxes. So in our example that had a lot of arrows going through to them, which was the sort of signposting to other services, that does point to an area that may be a focus of activity. And I think the key questions to ask when you're looking at a prioritised activity is what piece of work will engage frontline staff, and which drivers will result in the highest impact towards your aim. Are there any quick wins in there? Which ones are easier to work on given the resources you've got at hand? And what are the current level of performance on these drivers? So if you're doing a lot of work at the moment on trying to increase capacity, perhaps some focus on another part of another area of activity might give you some more yield early and some more results earlier on. So really this is the time when people are seeing the kind of change projects that are on offer, and you can start to harness the enthusiasm of the team as people pick out areas that they're interested in working on. There are another couple of tools that you can use for this, which I won't go into in much detail, but there's a sort of Pareto analysis or Pareto principle, and that is that 20% of your input accounts for 20% of your output. So you can do some work thinking around what are the areas on your driver diagram that sort of fit with the Pareto principle. And another thing here is a simple 2x2 prioritization matrix, again, which helps you, as a team, you can start putting the projects on here. Think about the ones that are from the no-brainers to ones that maybe need a little bit more work, or splitting up and trying to be worked on in different ways. There are different tools you can use to help with prioritization. Step 8 is to build in the measures through your driver diagram. So the question to always be asking yourself as you're looking at working on the measures is, how much by when? How will we know that a change is an improvement? What's the baseline? What's the existing evidence? What do we already know about these pieces of work? What are other people doing that we might be able to learn in this area, who we might be able to learn off? And also think about the things that you already measure. So there's always a tension between the burden of measurement and also the amount of information you get from it, and it's a fine balance to tread. But in general, you want to be looking at a mixture of structure, process, outcome measures, and also balancing measures to understand if there are these sort of unintended consequences of the work that you're doing. We often find it's a bit more challenging to set effective measurements for aims and primary drivers, because they're by definition often a bit more complicated, whereas it tends to be a little bit more straightforward to set measurement for change projects and secondary drivers. I've just put here on the slide a simple few questions to ask based on a paper by Keebler from '99, some that are called Top Tips for Metrics. It's worth just having a look at that. It's a useful paper to read. The next step is to get started. I've put here the Institute for Healthcare Improvement model for improvement. So always through your project, you're looking at what you're trying to accomplish, how we know that the change you make is an improvement, and then what changes can we make that will result in improvement. So that with the driver diagram, really focusing on that third line there, and then using tools like PDSA, Plan, Do, Study, Act cycles to understand whether to test out rapid cycles of change quickly and learn from them, and such that we can adjust the system or adjust the projects as we're going along. Next step is to revisit your driver diagram. Driver diagrams are really living things. They're a way to sort of not only display the strategy, but also look at how you're progressing with that strategy as you continue with your work. You can show successes on there, demonstrate progress, use them as a continued tool for engagement with more members of the team, share experiences, share learning, and so the best driver diagrams are never finished. Really, there are things that evolve with time. So worth revisiting, worth displaying prominently in a place where people can really engage with them in an ongoing basis. So there we have it then, 10 steps to developing your driver diagram. From gathering the right people in the room right through to revisiting the finished product. So in summary, driver diagrams. Over the last 3 lessons we've introduced you to what they are, why they're useful in bringing teams together, unleashing creative thinking and communicating strategy to try and improve your system. And finally, in this lesson, we've looked at how to develop a driver diagram step by step with your own team. So I hope you found these lessons useful and are feeling fired up and ready to take on driver diagrams yourself with your own team. Thank you very much.